Hello, everyone. Hi. Welcome, and a big thank you for being here today. So the first thing I'd like to do is to ask you to turn your mobile phone to either silent or off, please, so we can have your full attention for the club lunch on mental health, a very important issue. So we have your full attention. Thank you so much. Now, a little disclaimer on myself. I have done moderation of panels, but this is, I admit, my first time, so I hope I have your understanding if everything goes not all the way right. Thank you very much. So my name is Jenny Hsieh, and I have been a member of the FCC since just before COVID. I have built a career in financial services by day, but by night, I have been a passionate supporter of charities, particularly those in the mental health space. Currently, I'm also a member of the FCC Charity Committee, and we have the chair of the FCC Charity Committee here, Morgan Davis. The initiative that the committee launched last year, we call it One Day's Work. So the idea is that we'd like to encourage as many of you in the FCC community to donate 1 day's work, so shall we say about 8 hours work, to one of 9 charity partners that the committee has chosen. So this today is the first of a series of club lunches that we've organized to feature one or more of the partner charities who do the important work in one of 3 themes. So today the theme that we're focusing on is mental health. And we're going to hear about the work of the Samaritans Hong Kong, which, by the way, is also celebrating its 50th year of supporting mental health in Hong Kong. The idea is that we hope after hearing this talk, you'll go onto the charity section of the FCC website, have a look at information about the Samaritans or 8 other charities, and decide which one you're going to sign up and support with your good work. So after this lunch, feel free to please approach myself or Morgan with any questions about the initiative. So without further ado, I'd love to begin the event by asking my fellow speakers to please introduce themselves in a far better way than I can. So Scarlett, please.
Good afternoon, everyone. I'm Dr. Scarlett Matoli. I've been in Hong Kong for 20 years. My background starts off with neuropsych and clinical psych, and I work with individuals ranging from 5 and up. And when I'm doing that, sometimes I do work with individuals who are having a challenging time. So apart from psychotherapy, we also do assessments. And in doing that, I get a lot of risk assessments. So I'll be contributing that to our discussion today. And thank you, James, for introducing me to Jenny. Thank you.
Oh. You don't have to clap me, it's all right. I'm Brenda Schofield. I've been around in Hong Kong for 47 years in various iterations. Some of you may know me from other things. I'm here because I'm with the Samaritans and working with mental health issues with young people. I am a counsellor. I was a drama teacher, so the whole thing is kind of rolled into one. But I hope you learn something from today's talk. Thank you.
Okay, thank you for coming. Happy New Year, guys. My name is Paul Wong. I am a clinical psychologist, and I do teaching and researching on mental health, suicide prevention, and animal-assisted interventions in Hong Kong. I have been with the Samaritans for almost 20 years. Suicide prevention is one thing that is close to my heart, so I'm very honored to be here. Thank you. Jenny.
Thank you very much. So maybe to set the scene, I could ask our speakers to give us your view. Well, actually, before we do that, maybe you could share a little bit about what you think people in Hong Kong understand mental health to mean, and perhaps kind of how that impacts your area of work at the moment.
I'll kick that off. Mental health, I think, is understood as meaning something that you have separate from your physical health, and that most people, when they're coming in, they don't have a problem. Yeah, mostly they'll talk about feelings or something they don't discuss, and that when they talk about their body, it's a somatic complaint, and they'll go to the medical doctor. So I think a lot of times it's misunderstood as something that happens when you're at the end of your tether. It's only the absence of it that people can recognize often. yeah, rather than the presence of it, or the prevention, or something that we can boost up.
For me, I think mental health is when you feel that problems are really difficult to deal with in your life, and it's difficult to get on with your life if something is wrong with you. If we called it emotional health, wouldn't that be easier for some people? Because people think mental health, you're really screwed up, and you're not. You know, emotionally, you just can't live your life the way you would like to at the moment. And that, for me, is what mental health is about.
Well, mental health is actually quite complex or complicated to talk about. When in the old days, when we talk about physical health, people understand that I'm not sick, I'm not seeing doctors, and I'm physically healthy. But then we move on when the WHO says one person's health cannot live without mental health. And then we are defining what is mental health. Then we got into the discussion that, okay, we follow the physical health, that if someone is not seeing a psychologist, a counselor, or a psychologist, then they are mentally healthy. But then in the past 2 decades, then we talk about positive psychology, that human beings should be contributing to the society, contributing to the social network, and we got into this the discussion of a person's mental well-being should be much more than the absence of symptoms of psychological disorders. It should be about finding purpose of life, reason for living. There are lots of things that comes after for defining mental health. But then a few weeks ago, I talked about mental health with social workers. In Chinese, we wish people to have 身體健康 in Chinese New Year, healthy physical well-being, whatever. And then I asked them, what do you think about, what do you define, what is mental health? They said, oh, it should go away soon. So they were saying that mental health, the term, 精神健康 is a really negative thing that we should not talk about, that should go away anytime. So I said, well, it's wrong. You wish people to be physically healthy in Chinese New Year. Why don't you wish people to be mentally healthy in Chinese New Year? So there's still a lot of stigma about this term in our society. So I think we need to have more chats like this to raise the awareness.
Thank you, and I think you bring up a good point, Paul. You know, all of you have been in Hong Kong for a very, very long time. I'm just curious on how you've seen the evolution of mental health and, you know, people's attitude towards that evolve over your time in Hong Kong in the fields.
Well, I came back in Hong Kong in 2003 from Australia. I studied psychology in Australia for a decade. Then when I returned, I saw a really significant difference between the understanding or even the services for people with psychiatric illnesses in Australia and Hong Kong. On the Gold Coast, we were quite relaxed and stuff like that in the hospital, of psychiatric hospital. Then when I came back to Hong Kong, the people who were receiving psychiatric services in hospital, they were like prisoners. So when I invited someone from the WHO, obviously it's a non-Chinese, it's a 鬼佬, went into the hospital, and they were saying, oh, just the justice of peace is here, I need to report something to. So they treat themselves as prisoners. Anyhow, so in the past maybe 10 years, the Shall We Talk and the Hong Kong government has done a lot of things to advocate for the understanding and the promotion of mental well-being. And we have developed the hotline 18111 for emotional health, and then we have a hotline for caregivers of people with different kinds of illnesses. So the field has changed. Still, we have to talk more about it and make it more normal and common as a daily topic to talk about.
So more okay to be talked about.
Yep.
Yep. And how about you, Scarlett?
Well, also arriving in 2005, coming from very much an education about what our brain needs to do to be healthy. And so I'm coming from a science background, and I'm talking about it, and people ask, as they do in Hong Kong, what do you do? You know, and I give them the Hong Kong handshake of my card, and they're like, mental health? What's that? You know, it was a non-conversation starter, and it sort of revealed to me that this wasn't something I was necessarily going to be employed to do here. So it wasn't until my children needed a bit more help, and I started searching for services, that I learned the dearth of provision, starting from a young age. And I'm a Westerner, okay, so I'm looking for English-speaking services, and I kept getting referred to the public hospital. And the English was what it was. I'm taking it because it was all that was available. So I started my consultancy shortly afterwards, as you can imagine, literally to start to try and fill this gap and create a place where people could come, Westerners at least. Yeah, it's like even if I can't help with my skills, I will find someone for you. And that was unique. People flooded in. It was wonderful. And 2 years later, I saw a bunch of these things mushrooming up, and I'm like, yes, this conversation is nice now. I like this. And people then, Westerners, started having more assessments or coming in or whatever. They were doing it before, but it was quite limited. And I think the one thing that could get talked about more, at least, was coaching, right? So I would invite people in to talk about their psychotherapy for their child, and they're like, he doesn't have a problem, yeah? And I said, let's have a family meeting then. Lots of reticence. But I said, why don't we just do a family coaching session? Everybody showed up, because it was nothing to do with mental health. It was about growth and concrete things. And so I'm very happy that we're not in 2005 anymore, or even 2010. I agree. Wow, with the advent of so many public programs, it's more than just the private sector trying to pull up the bootstraps. We can really say, I don't want to rest yet, but I can sit more easily. There is a lot more provision out there.
Right, progress made. Brenda, how about you?
I think they've said it all, actually. Yes. When I look back on, I'm on hotline for Samaritans and also email. Sadly, we still have the same range of I'm about to say problems, but difficulties that people are in. That hasn't changed. But perhaps a willingness to actually pick up a phone, and that takes courage. Because you're going to speak to someone, no idea who they are. We have no idea who the caller is. But people have the courage to pick that up and say, sometimes they don't say anything because it's really scary, and you might get a few minutes of silence, but we have ways of helping them know that it's okay, we're still there. But it does take courage. But what they're concerned about really hasn't changed in Hong Kong, sadly.
So same problems, unfortunately.
Yes,
Yeah.
because we're humans.
And you bring up a really good point, Brenda. So recently, I heard about a study that said that time can be a really effective lifesaver when it comes to prevention of suicide. So what that means is that if someone feels the urge for example, suicide, simply just sitting tight and giving it, literally a matter of minutes, the urge will subside or potentially go away. Now, assuming that people do know about suicide prevention hotlines, and that's the first challenge. Assuming they do know, though, what are the reasons why they may not call or may not email for support?
I think for a start, I've had people call who say, is it okay if I'm not suicidal? Because people have an idea that we are only for suicidal people, and we are not. We are for anyone who is having difficulties, who is in that dark place and they don't know what to do about it. And I think that partly it's the fear of, can I express myself? Can I talk about what's happening to me? Can I find the words? Now, I'm not a Cantonese speaker, but I do know in Cantonese how to say, I'm so sorry, I don't speak good Cantonese, but there will be someone on duty in maybe half an hour. So that's one fear. And I think in order to pick that phone up and say, I feel like poop, I'm feeling awful, I don't know what to do, you open yourself up. It's like being naked to someone in a way, and it's a risk. So the person has to have courage at the end of the phone. But the sooner they do it, the better. And often, I'm sure any one of Samaritans will tell you that you'll get people saying, oh, well, I haven't talked to anyone about this before. I am so glad I'm able to talk. And we are ears, we are listeners, we are not advice givers. And that's the very different way that the three of us work. Because we're not there to give advice. We are there to listen, to hook into what's happening to this person and to think, okay, how can I best help them help themselves? And to be able to say, had you thought about, wonder, what was that like for you? Or is there anyone you can talk to at home? That sort of things. We are not experts. Okay, I'm a counsellor, but I'm not allowed to be a counsellor on the phone with Samaritans. That's the difference. We have very strict rules about this. But that's it, part of it.
Thank you. And Scarlett or Paul, kind of in your clinical experience, obviously if people come and talk to you, that's also buying a little bit of time. If they are feeling such suicidal urges, like what are the reasons why somebody may not want to come to you, or what do you think would help such people to be able to come to you?
Well, just briefly share that we do have children who share with their school counselor, for example, something's felt too big for them. And most school policies are that they need to share immediately. Now, in a regular counseling session, this is one of the boundaries, that it's harm to self, harm to others, or someone harming you. That's not cool. We need to take it out of the room. Yes, so when students share that in a school, the school has to put a big pause button on it and send it to the psychiatrist or the clinical psych. So what happens is they've now learned, if I share this really, really vulnerable information with someone, I'm going to get removed from my friends. I'm going to get removed from my life. Everything is going to stop. And that wasn't what I intended to have happen. I wanted help. I wanted to let go of this. It is terrifying. But instead they got brought to me. Now I hope I'm not very scary for most of them. You know, they kind of talk to me eventually. But it is, the process of it would impede them from coming back and doing it again sometimes. That's from a child perspective. I've got adult stories, but Paul's got loads of experience, yeah.
Thank you for asking this question. Well, we do research on help-seeking behavior. In the old days, we kind of really trivialize how help-seeking behavior is. We thought when people know they have issues, they will go and seek help and ask for help regardless of financial issues, regardless of stigma, regardless of discrimination or whatnot. They will just go into someone's office and ask for help. I need help. But it wasn't that easy. It has not been that easy. And just think about this, when you have issues like you have a runny nose and you are sneezing and stuff, how long does it take you to decide when you want to go and see a doctor? Even simple stuff like this. But for a person with like a suicidality that I've went through so many issues, I've been discriminated by people, and I might have depression and whatnot. It took a long time for people to decide when to seek help from others. So that's why time is actually really important. Help-seeking behavior has been trivialized for years in research and practice. Anyhow, so time is really important in terms of getting the almost immediate help, in terms of services, in terms of even not just professional help, but for people who like Brenda and Scarlett and myself, that can get access to the hearts of people. One thing that I do research is with the police negotiators in Hong Kong. The Kala in Hong Kong has been really famous. It was set up for terrorism and whatnot, but in Hong Kong, it's a really safe place. So the negotiators do a lot of work on suicide prevention. So when we go up to the roof and save life, we actually buy time for the people on the roof. How we buy time? We engage them, we listen to them, we talk to them, and we don't say anything. The hook, we were waiting for the hook for them to open up their mouth. And for hours and whatnot, when they're emotionally stable, then we can save life. Sometimes the suicidal actions are impulsive, so time is actually really important. Thank you.
Yeah, it was really interesting study. Sorry.
Can I share one more point? Just a little factoid. Emotions last for about 90 seconds. The actual emotion is actually so short. And that's that impulsivity is the bit that we need to lengthen out that time so that they get past it on literally a hormonal curve and a chemical curve, and we have a better chance of doing something. Yeah.
Really interesting, thank you. Now, obviously, the core service of suicide prevention hotlines like the Samaritans is the telephone hotline, which definitely works for the older folks, shall we say. But obviously, with the advent of technology and the younger folks, they might prefer different types of methods of communication. So can you maybe each comment on what kinds of other support have you seen that might align better, and how do you observe their interaction with these technologies?
Shall I go with, we have a hotline service and we have email service. And our guarantee is that if you email us, we will get an answer back to you in 24 hours, but in fact, it's much earlier. We have a team of, I think now it's 8 people who have trained specially to answer emails. We have quite a lot of young people doing this. And the nice thing is that you have an email there, you've got time. You've got time to make sure, what is this person asking? Have they called us before? We can find out, you know, from our records whether they've mailed us. And then when we've composed our answer, we have to give it to another person of the team to check it. Now, this might seem rather strange. It's because once it's in black and white, you can't take it back. We want to make sure that our language is right. And we found people who have been emailing us for years, and a lot of young people. We've had people from Africa emailing us. We've had people, you know, from outside Hong Kong who have some sort of connection. So we found quite young people do this. But the youngest person I've had on the hotline is 7 years old. So we often do get younger people, yeah.
Yeah, definitely can't get
But
that
we
out.
don't, we do those because we can control the time of it, and we can take our care with it. You know, we don't do, what would you call it, AI chat and stuff, but perhaps you know more about that.
Yeah, Paul, maybe you can tell us, because I know you've been doing some work with the government initiatives, right, to support mental health.
Well, since we have this now, the lifestyle has changed a lot. Especially Hong Kong people, do you realize when we use WhatsApp, they do voice recording instead of talking to people immediately? I have been asking this question for a long time. Why would people don't talk to each other and keep recording this? So anyhow, that lifestyle has changed, and then calling someone has not been a usual practice for a lot of people. So calling someone, it's not easy. And now we have AI. Can I ask you how many of you have used AI chatbot? Do you find it easier to talk to AI chatbot than normal people, like real people? No? Well, I'm starting a pilot of using AI chatbot to do suicide prevention. And we are finding that actually young people, they like to talk to AI chatbot rather than real people. Because for them, it was like, oh, I can find a person to reply immediately 24/7 without waiting. Even for hotlines and stuff like that, they still have to wait some time. But young people need immediate attention. So I think the AI will change the world again. The another point that I want to bring up is a lot of people think that AI cannot replace people. I agree with that. But there has been research saying that the AI actually facilitate people's help-seeking behavior. Once they get into the habit of talking to an AI chatbot or a text-based hotline or whatever, they're more likely to seek help afterwards because it was difficult from 0 to 1. But once they reach 1, they're more likely to go 1.1 or 1 to 2. So that is the point that we have been amazed by what's happening with AI and the technology.
So it sounds like what you're saying is that the AI chatbot is perhaps helping to that time aspect that we just spoke about, right? Maybe they can't find a live person immediately, but having that chatbot available, it buys that, you know, very valuable time so that it comes off the boil, right? That's a really good point. I don't know if Brenda or Scarlett, you have any other experience to share on the advent of AI in the mental health space.
Not with AI per se, but with a slightly previous version. In the US, there's some wonderful research that happens with veterans. 67,000 people in these cohorts in this research. And there was a preference for joining first with someone who was non-threatening. These people are bringing up incredibly vulnerable stuff, and they're tough, and they can't be showing this. And they found that there was an initiation phase, but they wouldn't stay with it. And what they preferred were group with people who had similar experiences. So it did work as a facilitation stage. But this is, again, well-documented research and many, many research. So I think there's good evidence for it.
So it sounds like for people who are perhaps brand new to the concept of talking to someone, it helps to, like a halfway point, to get them used to it. That's great. Brenda?
I would talk about connection, which I think is the most valuable thing. You're going to make connections here, and I hope I'm going to make connections with you for Samaritans afterwards. The whole point is, I think of it as a golden thread between two people. And if you can get that connection going, it feeds the spirit. And I think this is the thing that we have got, on the phone. There's nothing like it. If that person, we're all human beings, and what you all need is to be seen and to be heard. Those are the essential things. We've all been in bad places, and if you haven't been in a bad place, you will be at some point in your life, right? That's because we're human. If you can get that wonderful golden connection with someone, and you can all do it. You don't have to be trained to do this. To have the courage to go to someone and say, can I help you? It really is so important. And for me, that's what it's all about. And mental health and working with people who are feeling really bad, connect, really make that connection.
Absolutely. Thank you, Brenda.
I went off tangent, but never mind.
No, that's great. That's great.
I always
Thank
do.
you. No, maybe slightly shifting our attention. For those of you who haven't seen, Paul was one of the speakers at TEDx Tin Hau Women, and he did a fantastic talk on mental health and men. That is available on the Tin Hau Women, TEDx Tin Hau Women website. But just, we talked already about how it's difficult for some people to go after mental health support when they need it. I think there are particular reasons why it might be particularly difficult for men. So maybe, Paul, I can ask you to start and then ask the other speakers to come in.
Thank you for asking that and sharing that information. I started to have an interest of studying men's mental health maybe last year because I was invited by an NGO to talk about men's mental health because they started the first mental health for men's support group in Hong Kong. So they asked me to talk about that. I didn't know too much, even though I am a man. So I did some research on that, and I found that there are not so much research on this area. They talk about women, they talk about children, they talk about elderly, but not so much about men, especially middle-aged men. Then I went into studying like the Chinese culture of how men see themselves and how men see their weaknesses. And it's a really interesting point that I found that was discussed in the Chinese literature. Chinese men supposed to see themselves as a combination of a scholar and a warrior. So if you go to Shanghai and then you see the Menwu temple, Menwu Miao, the one is the scholar, the Wu is the warrior. So if you go into the temple, you should, especially for men, you should worship the scholar and then the warrior at the same time. So a lot of Chinese men see themselves that if you are really like a physical person and warrior, then you should read more books in your later life. So when you're young, you should be physical, and then when you're older, you should be scholar. Then I thought about that, and then is it really just Chinese, or is it really that applying for a lot of men? And then I studied in Australia for almost 10 years. So when I saw the young kids, they were playing rugby and touch football and whatnot, they're so physical. But then when they're younger, they can't be so physical. They got into something like gardening. They still have to be like a scholar and read a lot of books. So I thought, well, maybe men face a lot of issues inside, but they can't tell people. So especially for people with mental health issues, it's a weakness that they feel. Scholarly, I'm feeling that I'm not knowing enough about mental health. Physically, I'm fit enough to be mentally fit. So that's why they feel so shame and guilt to seek help. So men's mental health is a topic that must be talked more about, and we should open up and that. And in my TEDx talk, my last sentence was addressing to the women. Please be more gentle with men. We are not that strong. We are weak too.
Noted, noted. So Scarlett or Brenda, any thoughts on this topic?
Most definitely. I think there's a generational shift that seems to be coming into it. I know that my grandfather had a certain language and dialect in the way things were shared and what wasn't spoken of. And I know that my father had his way of doing it. And I have 3 brothers who are wonderful. And they speak very differently to their children. And I think the power of being brave enough to move off of that old narrative, that paradigm shift is important, but it's hard. Because you keep getting reinforced by employers who may have older language, who may be holding those values closely. And we know that big businesses are built on this. We need people who are tough and are warriors. If a woman wants to rise to the top, she's got to be better than a man. Right? We see examples everywhere, but is it really necessary? If we never have the language of, I'm a human and I'm feeling a feeling, because that's what bodies do, what are we doing here? Yeah, so I think there's a lot more scope, and it has changed. And I also have part of the family history where people didn't get allowed to speak, and we can see what happened to them. Yeah, it wasn't a good outcome. Yeah, Brenda.
You've said everything, actually.
Thank you very much. We'll be opening up for Q&A shortly, so for those of you who have questions, please do raise your hand in a moment. But the last one that I have is, so again, at another talk that I went to, I heard it being said that people, if you have factual difficulties in your life, like poverty or you're facing gambling debt, you're not actually mentally ill if you're facing these problems, you're just facing problems. And they just really need real life solutions. But of course, the role of counselors and also services like the Samaritans Hong Kong is not to give practical advice. So I wondered if each of the speakers could talk about, when you encounter somebody like that, how do you work with them in a way that is kind of true to the values in the profession, but still try to get people the help that they need?
Maybe I'll just start with that, because in the private space, as I shared earlier, we do have this boundary of confidentiality. And the utmost thing is to protect every life, all right? So as long as we've got that in place, it's fine. If we breach that wall, we have to go out. People do come in and expect a counselor to be teacher and give advice. What we do is we sit more comfortably in the psychoeducation space. Here's an accurate description of a stress response. Do you think that sounds like you? Because we're talking about somatic experience rather than emotion. Same with anxiety. I don't experience anxiety. I say, did you feel it in your tummy and in your heart, and is it racing? That's anxiety. So a lot of time the psychoeducation is more powerful because we leave it to them to choose how they're going to frame it. So, but that's not advice. We wouldn't give it. But sometimes the education piece, more powerful than even the talk therapy sometimes, just from the private practice.
We also, of course, work confidentially, and we don't know who's calling. We never see the number of the person who is calling. But I think what happens often is that somebody calls and they're finding it difficult to find the words. I am not allowed to give advice, but what I often hear is, what should I do? Some people will say, I phoned you for advice. You're the Samaritans. You're supposed to help. But we're not giving advice because we do not know that person. We had no chance to do that. So what we have to find is a way around. And one of the things I love is, I wonder what would happen if, or had you thought about this? Because our job is to help someone explore ways they can help themselves. Sometimes they're absolutely saying, but I want to know what to do. And I said, I don't think I can tell you what to do. Let me see, what ideas have you got? And that's the way that we handle that. And often, people are calling and they're almost like in a soup. You know what I mean? It's like they're plowing through this because they're not sure what it is they're feeling. So part of our job is to help them identify what they're feeling. We are not there. Obviously, I have to stop myself doing what I would do as a counselor. And I was told when I joined the Samaritans and I was training and they knew I was a counselor, they said, "Oh, don't worry, we'll soon knock that out of you." Because it's hard when all your instinct is to ask certain questions. We try not to ask too many questions. We ask only open questions, never a closed question. But sometimes it's really tough and you have to go back to the very strict rules that Samaritans work on. But they're there for a purpose. They're there for a purpose.
Paul, any thoughts on? Okay, great. So, any questions from the audience, please? Yeah.
I'm not too sure I can phrase this very well, but thank you. There's been talk about generations changing, how they speak to their kids, and how we're more open. My question is the other way around. What about oversharing today? I think we live in a society where there's a lot of social media, and we read a lot about bullying, we read a lot about issues or kids doing some imitating somebody else, which is something a little bit dangerous. And so what about this oversharing? How is this affecting, in your point of view, the society today?
Such a great question. But the oversharing, that at least when I have young people coming in, I can speak from the point of view that it affects them and that they know everything. Yeah, they're more empowered to speak about it because they heard 12 other people speak about it. So I think there's a positive effect, and that when people feel free and unfettered, they said that, and it sounded about right. It's kind of describing what I'm feeling, but I couldn't find the words for. So sometimes I think it helps people. On the other hand, I do have 14-year-old girls who are quoting the DSM to me, and they're like, "I have this, and they're listing it in order so they can self-diagnose. So I think it's a double-edged sword, personally, but yeah.
Thank you for saying that. It's actually happening a lot for cyberbullying, and suicidality is a big thing because you hear a lot of suicide cases of young people, they are cyberbullied and stuff like that. One thing, there's no easy solution for that, I have to say, but there are two things I think we need to do. First is to get the young people to realize what they see from the so-called social media and whatnot. It's the tip of the iceberg of a person who just show the positive aspect of a person. And there's so many things underneath. There's shame and depression and anger and stuff behind it. So please have a critical mindset of seeing what you see. And then the second thing is, I must say that the internet service provider and the social media founder, they have the responsibility to control something. Like, for example, maybe a decade ago, Facebook has started to have the button for people, if they see anything about suicidal behavior, they can press the button and Facebook will stop spreading those stuff. So I think these initiatives must be done more. Like for now with TikTok and DeepSeek and all that stuff. So the people who earn money from doing this, they have the responsibility to do something. Yeah, that's one thing. Thank you.
Lawrence.
I understand there's a pretty well-accepted consensus in society, in Hong Kong and overseas, that mental health problems are more pervasive now, affect a wider segment of the community at various ages than 10 years, 20 years, or 30 years ago. I'd be very interested in the views of the panel about why this is the case. What's different about our society, our technology, our relationships today that makes this troubling for more people than perhaps it did in the past?
Shall I come from a very practical point of view? What I have observed over the years with telephones and Samaritans is that, of course, the stress on young people, I'm particularly interested in young people, the stress has got much greater. They've had to deal with COVID. They are so frightened that they will not get the grades they're going to need. There's the dreaded DSE examination. Mums and dads in some of the less well-off areas of Hong Kong are so busy trying to get food on the table and get out to work that they don't simply have time to notice what is happening to their children. They don't know when someone is depressed. Why are they doing this? And part of a job that I will talk to you later about in Samaritans is to help educate mums and dads and teachers to recognize what's happening to children. But for me, I think COVID had an enormous effect on the young people that I'm particularly interested in. And, you know, dare we say that, you know, Hong Kong has changed greatly over the last few years, and people are coming to terms with this, that it's not the Hong Kong they knew.
Hey, one thing that I do want to share with you, Lawrence, for me, for my research and suicide prevention and whatnot, we have found that one of the most significant protective factors for people for not attempting suicide is social support and connection. And I think over the years, people are not so connect with each other anymore. As Brenda has said, connection is important. We had some discussion when the book called Bowling Alone came out 40, 50 years ago in the US. Bowling used to be like a family issue and stuff. People talk and have time together. And then if you go to Japan, there's the public bath and onsen, and people, they don't know each other, they talk. But now, ask yourself how much time that you actually have connection with people. And that is quite significant. Loneliness has become a pandemic. And the WHO and the UN has declared that. The UK and the Japan has the commissioner of loneliness. And it makes us to realize how disconnected we are, even though we are socially connected with so many people, but we are just isolated and lonely. So that is one thing that I think has a lot of contribution to why people have a lot of issues nowadays. We don't have enough time to support and talk and just be a thing with people. You know, that is important.
And just following on from that, I think it's true. There are a lot of factors that contribute to why do we have more now. I think from a statistical point of view, we have more humans on the planet, and therefore we have more opportunity for these things. We have more people crowded, more demand. We have a lot more awareness now. We use this language more frequently. People can identify something they couldn't identify before. So sometimes we have an artificial elevation in it simply because more people found the name. So I think it's multifaceted. What's the cause? But I would have to agree that some of the biggest core pieces that we could change would be that connection. And in addictions research, which is one of my primary areas starting 35 years ago, we have 5 basic drives. And this is the first thing we're taught. Water. If you do not have enough water, your body will shut you down. Sleep is next. Then food. And next is connection, an intimate connection. And these are the things that make us thrive. And it's the core of our being as humans, and it makes us unique. And without it, we do something very different. Yeah, but it's a drive. It's not even just something nice. It's fundamental.
Thank you. So we're a little bit short on time, but I'm going to exercise the moderator's right to impose the last question by really just giving Brenda the floor. Or maybe, okay, one more question, sorry.
Anna Fenton, former president of the club. Brenda, many years ago, wind your mind back, I interviewed you about fetish fashion, and something you said has stuck with me ever since. Now, for those of you who are thankfully too young to know what fetish fashion was, I'll let Brenda explain. But briefly, it was a house of fun under the escalator, which got into a lot of trouble and ended up in a rather prurient court case, I think you could agree. Anyway, I had a long chat with you back then, and you said that you felt that apart from the fun and games, which provided a very real service to society, that what you also did was supply a counselling service like no other in Hong Kong for the, I think you said 10% of people who believe they are wired for BDSM and would know from a really young age that they felt that way. They would like tight clothes and all this kind of thing. And that struck me then that when fetish fashion closed down, what happened to that 10% of society? Where do people with, sexual fetish and kink go these days in the general population for help?
Now you know who I am. The other side of me. Oh, we're still here. We are all still here. And there are various places that people meet. I'm not supposed to talk about this here, I'm very sorry, but munches where they will meet in a bar together, people who have the same interest in, should we say it, minority sexuality. And here's one thing I believe, and I've got to say it now because I'm here on a podium. You cannot be all you are meant to be until you are at ease with your sexuality, whatever it is. And that's what I really believe. I'll talk to you more about it later if anyone's interested.
Thank you for that.
Which is the fifth drive,
I
by the
thought
way.
that would come up. Right, never mind.
But I'm going to give the floor back to you, Brenda, because we are here to really learn more about the Samaritans, which is one of the 9 partner charities that the committee has chosen to work with this year. So I'd love to give the floor to Brenda to tell us a little bit more about the Samaritans and how each of you can help.
Okay, I'll be really quick. My pitch is that there are people in this room who have skills who can really help the Samaritans as an organization, because we've got writers here, we've got people who understand publicity, we've got photographers in this room. We're not asking you to come and get on the phones, we can't do that. So this idea of giving 8 hours, much more please, of your time to the Samaritans doesn't mean you're going to come and train. It would be lovely if some of you thought, I might want to do this. Then it's quite a long process, but it's very fulfilling. But there are other skills that we need because, we may not be great at publicity. In fact, we are not good at publicity. We need much more, but we need people to help us say, well, you could do this, you could do that. I'll write you a press release. We can be in the media much more. I'm personally a great believer in this, which is why I spend a lot of my time. I will speak to anybody who will listen about the Samaritans, anybody. But this is really important to us. If you feel you have got a skill that could be useful to us, please go onto the website of FCC.
That's right. There's the charity section on the FCC website. It'll give you a lot of information about each of the charities, and also that's where you sign up.
Yeah, and it would be wonderful if people came to help us. Of course, if you've got a couple of million to give us, that's even better, because we're always very happy to receive money to help us. But if you've got that skill, please let us know. If you're interested, if you think the Samaritans is something that you might like to work within the organization, then the same thing, contact them or contact me, and we'll be happy to see you. Okay? We're not a secret society, but we're plugging away 24 hours a day, really.
Thank you very much, Brenda. And may I take this moment to ask you to put your hands together for our speakers, Dr. Paul Wong, Dr. Scarlett Matoli, and also Brenda Schofield. Thank you so much. Now, if you've enjoyed the event today, which I hope you have, and would like to become a member, please look at the brochure that's been left on your chair for a membership. There's also many more of these events upcoming, 2 of which are here. So there's going to be a screening on the 24th of February called As Time Goes By in Shanghai. The director of that film will be here. It will also have a moderated panel. There's also another club lunch to take place on the 25th of February on the book called Art in Hong Kong. The author, called Enid Tsui, will be here to talk about her book, and I hope to see you all there. Thank you very much.